Well, I want to tell you about something that's not very much of a pleasure to discuss. It is COVID-19. It is getting terrible. There's been another significant increase in cases here in Ghana. Severe cases are rising by nearly 100%, and the critical cases are going up by 177%. Six new fresh names have been wiped off the earth. They have died. The country's active cases continues to rise. Let's cross over onto Zoom. Head of our health desk here at JoyNews, Fred Smith, is joining me to help us understand the figures better. Fred, I've gone through a bit of the percentages. Break it down for us.
Well, on Saturday, the figures I have here for you are figures that the Ghana Health Service picked up on Saturday. And the new cases recorded on that day, 366 of all samples that were taken on that day, they came out positive. Now, it brings our active cases to 2,174. And there's the difference between this and what we had a day before it, that was on Friday. That's 250. So it is still worrying. Our active cases are going up. It means our recovery is lower than we used to have. It brings our total confirmed cases to 58,431 cases so far since the outbreak in March last year. And in spite of that, we've had 55,899 recoveries. The deaths, as we know now, it's 358. We've had 6 deaths between Friday and Saturday. Those are the figures from there. But if you look behind those figures, you realize that our severe cases are also going up. Currently, we have 98 severe cases. On Friday, when the Ghana Health Service released their report, we had 51 severe cases. That's a jump of close to 100%, 92% thereabout. And then as we speak, on Friday, we have 13 critical cases. As we speak, we have 36, that's 177 cases so far, percent rise so far, Gifty. And the president's warning was that if these things continued, he would not hesitate to impose a lockdown as we had sometime last year to try and slow the spread of the virus.
Fred, so 6 people in 2 days, Friday and Saturday?
No, this is just for Saturday.
So 6 people died just on Saturday?
Yes.
Wow.
According to the report by the Ghana Health Service.
And is it possible that it's rather the time of reporting, or that actually 6 people died in one day?
Indeed, the report from the Ghana Health Service, you have a copy I saw that you displayed a while ago. It shows that the data we have now is for the 16th of January 2021 and no other day inclusive. So it explains that the data we have is for those who were either tested on that day or those who were either being treated or were in hospital on that day, and events that happened regarding their treatment.
I shudder to think what to expect in the coming days, especially now that we know that there is the new variant is here, and that new variant is pretty deadly. Fred, I know that you've been having behind the scenes conversations about on this particular matter of new variant. What more can you tell us about it?
Well, the experts are still studying the new variant or variants because it's possible we have more than one. The scientists at WACBIP did the sequencing and they realized that we have this. Now, those are the labs will now investigate to see which variants we have and whether they were imported or they developed here in Ghana. And if so, how are the new characteristics that these variants are coming with and how we approach our treatment regimes. It may influence a change in how we treat or manage the virus itself, but essentially, it's still COVID, and it spreads from person to person. If, for instance, you're not wearing a face mask, or you are touching places where you're not supposed to touch, somebody touches a surface and maybe the person is infected, you go and touch the same surface and then you rub your eyes or your mouth, your nose, you are picking up those infections. And that's how come we've been told to wash our hands on a regular basis, to apply the hand sanitizers where the washing of hands is not possible. And this we are told to do under running water, such that whatever you wash will go away.
Hang on with me, Fred. Let's take a look at a statement. Now, 4 of the country's nurses at the front line in the fight against the COVID pandemic have succumbed, we're told, to the disease. Now, that's according to the Ghana Registered Nurses and Midwives Association, which says many others are currently battling for their lives in health facilities across the country. A statement they issued on Tuesday is what contains this information. And I just go through the statement for you, and then I take your thoughts on this, Fred. It says that the world at large is battling the deadly COVID-19 virus, and the increasing number of cases in Ghana within a short space of time is a worrying development. The Ghana Registered Nurses and Midwives Association, having observed recent happenings in the country, wish to put across the following. Number 1, there is total disregard for the COVID-19 protocols by majority of Ghanaians. So they go on and they break it down there, that people are not observing the protocols, especially when it comes to the wearing of face masks at public places, which is a worrying trend because it exposes everyone potentially picking up the virus from infected asymptomatic persons. Considering that there are already imported cases of the new variants, the statement says, and the possibility of its existence already in the communities, the non-adherence to protocols will in no time result in an escalation of new cases, which will overwhelm our already fragile health system. And the second point that they make is that there's a breakdown of routine protocols at the health facilities in the country. Measures that worked for us in the first and second quarter of 2020, such as pre-training, pre-triaging, triaging and enhancing testing, which is triaging is essentially separating the people who are suspected to have been infected. Enhanced testing and contact tracing have been virtually abandoned in most health facilities. That's another concern that the nurses are raising. And they're also they're calling on managers within the health service, the teaching hospitals, etc., the facilities, to revert to the processes, the hygiene protocols that we had, the pre-triaging, the triaging of patients and identification of quarantine and isolation centers. Fred, I will finish with I'll go on to the third point that they make, but I want to take your thoughts on what we have seen so far. You recently visited the hospitals. Do the things that the nurses are saying in this statement resonate with what you saw?
Well, there are some protocols. I was, for instance, at the East Municipal Hospital. I was also at the University of Ghana Medical Center. What you do is a normal protocol as you do in visiting any organization or any public place. You'd have to wash your hands under running water with soap, and then you would have to apply the hand sanitizer before you access the facility. I did not go there to seek medical attention, and so I cannot say for a fact that that is being done or not being done. And so these are the frontline workers who have members across, and so I believe that what they say is actually what's happening.
Let me go on to the next part of the statement. It says at the peak of the first wave in July 2020, 840 nurses and midwives had been infected and 2 people had died, or 2 deaths had been recorded. The death toll now stands at 4, with the recent demise of Mr. Solomon Nso, a senior staff nurse who worked at War Memorial. So the full statement is on myjoyonline.com, and you can take a look, take your time and take a look at it. But Fred, let me just take your final words on how things are panning out with COVID-19.
Well, we're getting to a stage where the virus is spreading very fast, and I have my map right before me, and I see the problem areas, or what you call a hotspot, the hotspot areas, the Greater Accra region, 1,149 cases so far. We have 179 so far in the Ashanti region, and I'm talking about active cases, 128 in the Western region. We have 50 somewhere in the Eastern region, thereabouts. So the cases are spread around the south and towards Ashanti region. And we know a lot of persons move about a lot in Greater Accra. We have lots of international travelers arriving in Greater Accra. Many going to the Ashanti region and some going to other places such as the Western region, because you know we have oil rigs there. People go to do business regarding oil in that area. We have
mining
Eastern
as
region,
well.
which is mining as well. We have Eastern region where there's lots of mining activities taking place, and Ashanti, there's mining activities taking place as well. There's a part of the Volta region that's also struggling a bit. A few regions are without cases at all, but we'll come back to that later. What we need to do is to ensure that at the local level, we all do what we can to ensure that we are able to follow the policies the central government is giving us. So, for instance, the president will say, let's all wear the face mask. I would expect that the metropolitan, municipal, and district chief executives who are still at post in spite of the period we are in, to lead the charge in ensuring that we are all complying. The president has already spoken to the IGP to ensure that they make men available from the police service to enforce this. If the assemblies commit themselves to this, it is better than campaigning to get the president to maintain them in their offices. I'm sure if they do this and do it well, the president will see their good works and keep them there. That's the way we can go. We can take it one at a time, do it in small groups, and by the time we realize we would have been able to conquer this. Our situation is not as bad as other countries that are really struggling. So we have the upper hand over the virus, and we can deal with it. We can eliminate it completely if we put our shoulders to the wheel.
It all boils down to us and our role in the whole process. Fred, thank you.